How did trachoma impact immigrants at Ellis Island Museum? Imagine arriving at a new country full of hope, only to face a health check that could change everything. That was the reality for many immigrants at Ellis Island in the early 1900s. Trachoma, a bacterial infection, was a big concern back then. It spreads easily through contact and can cause blindness if not treated. Because of this, health officials at Ellis Island had strict rules to prevent its spread. When immigrants arrived, they underwent a thorough medical exam. Doctors used a tool called a button hook to flip back the eyelids and look for signs of trachoma. This was a quick but intense process. Many immigrants feared the button hook because, if signs of infection were found, they could be sent back to their home countries. Others were treated in the island's hospital, which was one of the first places in the United States to care for trachoma patients. The impact of these inspections was serious. If an immigrant was diagnosed with trachoma, they faced the possibility of deportation. This meant leaving behind their dreams and family, sometimes forever. For the United States and New York State, stopping the disease from spreading was a top priority. Trachoma was common in parts of Europe, especially southern and eastern regions, where many immigrants came from. The health checks helped keep the disease from spreading further into the country. This process was well known at the time and even appeared in movies like The Godfather Part 2. It showed how important health screenings were in protecting the population. The inspections also reflected the broader efforts to control infectious diseases during that era. Ellis Island was not just a place of hope but also a barrier that kept contagious diseases out of the United States. So, in the end, the impact of trachoma inspections was huge. They determined who could enter the country and who had to go back. For many immigrants, it was a moment of fear and uncertainty. But for the nation, it was a vital step in safeguarding public health. The story of how trachoma affected those arriving at Ellis Island is a reminder of the challenges faced during that time and the efforts made to protect everyone.